Wonderful. Well, good morning. Thank you for joining. My name is Dr. Doug Wingate. This morning we're going to talk about neuroplasticity support for microdosing. So we're going to start by talking about psilocybin, which is primarily a psychedelic that I work with. I'm a legal psychedelic and psilocybin facilitator in the state of Oregon. Uh, Psilocybin's been legal for a couple years now here in Oregon. So I've worked with the Integrative Psychiatry Institute and co-founded Seven Gate Sanctuary in Portland, Oregon, where I facilitate journeys and have had the opportunity to facilitate for hundreds of individuals over that span of a couple years, both in training programs and individual and group journeys. And it includes group microdosing. And we're going to talk about more about microdosing today than some of my other talks, and then different ways that you can support that. So let's see if we can get going here. Um, Before we get started, a little disclaimer that we're going to talk about a number of different herbal substances, herbal supplements, and things like that. That what we're talking about is for educational purposes and it's not intended to be any sort of prescription for any sort of disease. And it's also not an endorsement for the use of any illegal substance. As I mentioned, I'm a licensed facilitator of psilocybin both in Oregon and I'm licensed in Colorado as well. And that's while we're going to talk about psilocybin, it is and remains a federally regulated substance within the United States and throughout the world. For the most part, it's also illegal. So I'm not advocating for any illegal use of illicit substances, but we're going to talk about it and we're going to talk about psilocybin. There's a lot of discussion around psilocybin for its potential as an entheogen or as a psychedelic substance, and the potential benefit for a lot of mental emotional concerns. We're going to discuss it more in the context of how it can be supportive for the brain and the nervous system. So, from more of a what I've deemed neuromycology or from a neurological perspective, knowing that all of that falls within the context of uh, all of the other discussion around psychospiritual components and things like that. We're just not going to lean heavily into that for this talk because we're going to talk about microdosing, how that impacts the nervous system and different ways that we can support that with other substances as well. So, psilocybin, there are over 100 different species of psychedelic mushroom that produce psilocybin. We're going to focus on Psilocybe cubensis. Reason for that is in Oregon's legislation, that's the only type of psychedelic mushroom, psilocybin producing mushroom that has been legalized. So just to know, there's a lot of different species of psychedelic mushroom. We're going to talk about Psilocybe cubensis in particular for that reason. So just generally speaking, some key actions of psilocybin alongside the psychospiritual components. It is considered an entheogen or psychedelic. Psychedelic meaning mind manifesting. So it can be very revealing or opening of oneself to their internal processes and their psychospiritual growth and development and awareness around that. And within that comes larger conversations that I have in some of my other teachings around metacognition and being able to more effectively reflect on your internal state, your belief systems, the way that you look at the world and the maps of reality that have been formed, and how psilocybin can help either expand that perspective or allow for a better reflection or more reflection on that. Um, Outside of or beyond that, psilocybin is also considered neurogenic. We'll talk about some of the specifics and some of the research that's been taking a look at how psilocybin acts on the brain and the nervous system, what the neurobiological mechanisms are. It's also serotonergic. Psilocybin acts on the serotonin system. Serotonin is a neurotransmitter in the body. It has a lot of different functions. A lot of those have to do with mood and regulation. It also is vastly involved in inflammatory processes and things like that. You have a couple areas in the brain that produce serotonin, and then serotonin influences pretty much all of the brain tissue in different ways. And then also, uh, in terms of just bulk of serotonin that's produced throughout the body, the vast majority is actually produced in the gut. And so that again has wide-ranging influences throughout the body, certainly the gut itself with inflammatory processes and maintaining, but that also reinforces a uh, more recent understanding of how important the gut-brain axis is, the relationship between our gut and gut health and functionality of the rest of our nervous system and our brain. And so we'll touch on that just a little bit more, but an awareness that's been shown to be a really important dynamic in health and maintaining. So if our gut is not flourishing, our brain and the rest of our nervous system and the rest of our body is not flourishing as well. And to know that there is that tie-in with serotonin, and that psilocybin works on the serotonin receptors. In particular, it works on what's called the serotonin 2A receptor. Psilocybin has also been shown to be systemically anti-inflammatory, and some of that has to do with that serotonin relationship. So, in situations where they're taking a look at research for things like chronic pain conditions, systemic inflammatory conditions, there's really compelling evidence for psilocybin to be a potential intervention for that or be helpful in breaking out of those cycles of inflammation or clearing out inflammation in the body. So we're going to talk a little bit more about different research that's been done with psilocybin, and then we'll talk about microdosing in particular, and then we'll go on to talk about different ways that you may be able to support microdosing. Before we do that, the caution and and contraindications around psilocybin, there are a few, certainly because it induces an altered state of consciousness, at least in what's considered a macrodose or a therapeutic or effective dose. This can be a destabilizing event. It can um, expand perception, but if you're already in a state of mind that's not particularly stable, or there's a lot of different moving components going on, it may be difficult to navigate or integrate that altered state. It can be destabilizing. So when somebody is interested in pursuing psilocybin and having me facilitate, we always do an intake first, a preparation session, and make sure that it's going to be appropriate, that they're in a place where they may be able to successfully navigate and integrate that experience in. If people are in a state of any sort of mania or submanic states, or any recent history of psychosis or familial history of any sort of schizoaffective tendencies or tendencies towards psychosis, these are all destabilized states that they can be exacerbated by psilocybin. So that's really important. There are other talks I've done and a lot of information about the cautions and indications. So I'm not going to talk extensively about that, but to know that there is certainly situations where psilocybin is not appropriate, and we wouldn't want to move forward even with a facilitation. Another one of the cautions and contraindications that you want to be aware of around psilocybin certainly is with medication interactions. I have other talks about that, but one really important one is with lithium. Um, it's within Oregon law that anybody who's taken lithium within 30 days cannot access psilocybin because it significantly increases risk of seizure, and obviously we don't want that to happen. So that's a really important contraindication that I want to at least make mention of here. Okay, we're going to talk about some research around psilocybin, or just relatively briefly, just different areas where research has been done. There's actually quite a bit of research when it comes to psilocybin. So when I was putting together different resources about different medicinal mushrooms and research around neurological conditions and working with the brain and the nervous system and neurobiological mechanisms, psilocybin actually had significantly more than a lot of the other medicinal mushrooms that were out there, just because there's a lot of interest in the potency of the psilocybin experience. And because of that, we've had an opportunity to learn a lot about the mechanisms and what it does. So there's a lot of research taking a look at memory, cognition, functioning, and learning, and how psilocybin can impact that. So psilocybin has shown significant improvements in studies with cognitive diffusion, valued lived in, or values congruent living. There's a study that took a look at and asked, how congruent are your actions in the way that you navigate the world compared to your internal values? And psilocybin is shown to have an increase in that values congruent living or living in congruence with your own personal values. It's also showed improvements with areas of self-compassion and overall psychological flexibility, so adaptability, um, mentally, emotionally, psychologically, being able to be more flexible and adaptable to situations and information. So we talked about psilocybin works on the serotonin receptor, the 2A receptor. Modulation of that receptor causes improvements in cognitive functions that include creativity, cognitive flexibility, and emotional facial recognition, which has a direct tie-in with empathy. So there's some really intriguing conversations around how psilocybin experiences may actually have the capacity to increase empathy as well, the connection with others and understanding for others and the shared humanity and the shared experience that we're all a part of. Uh, they've done research around trauma and fear conditioning, and they've taken a look and found that psilocybin influences the amygdala, an area of the brain that has a lot to do with the fear response, and the feeling of fear or anger, or a number of other strong emotions, but it's really tied into that fear response, and it comes into play a lot with things like PTSD, and that psilocybin has been shown to weaken the processing of the negative stimuli, so these negative feedback loops, or the fear conditioning or the trauma response itself, that psilocybin lessens that, playing a key role in how it may be an intervention for anxiety and depression. Of course, there's research around psilocybin for major depressive disorder, treatment-resistant depression, both of which right now are on phase 3 FDA trials for approval and having really remarkable preliminary results to the point that it's been granted breakthrough therapy status. So the FDA is fast tracking that and really paying attention to that material that's coming out. It's also been shown to directly ameliorate the fear response that's triggered by traumatic injury memories and with associated stimuli for those traumatic memories, allowing for people to both confront that material and take a look at it and being able to reflect on it without it being as activating and processing through those traumatic experiences, which is a key arena where psilocybin may be really helpful in PTSD, complex PTSD, and other trauma situations. A lot of research with psilocybin for depression. I already mentioned that there are multiple studies taking a look at that right now that are in phase 3 FDA clinical trials, and should be wrapping up in the next few years, which will make for a really interesting conversation as they make their argument to reschedule psilocybin on a federal level. Psilocybin has also been shown to have anti-aging properties. So there's what's referred to as the psilocybin telomere hypothesis, that psilocybin has a direct influence on telomeres. Telomeres are portions of the cell that get clipped every time that the cell regenerates and is considered a biomarker for the aging process. So as our telomeres shorten over time, that's associated with our lifespan, and psilocybin having an influence on those telomeres points to a possibility of psilocybin influencing longevity and having these anti-aging properties. Acquired brain injury. I've done whole talks on psilocybin as a potential intervention or support mechanism for acquired brain injury or traumatic brain injury, post-concussion, and stroke. And so I would point you to those if you want more information, just to know that there is a fair amount of evidence pointing to psilocybin promoting neuronal growth, which is regeneration of the brain tissue, of the neural tissue, and creating more neural connections and also creating more adaptability in the nervous system, as well as promoting cell survival. So if there's injury to the tissue, maintaining the integrity of the tissue as best as possible and having systemic anti-inflammatory properties that include the central nervous system. So being able to reduce that inflammation vastly improves the possibility for positive outcome after a brain injury. Peripheral nerve stimulation, we talked about serotonin being a good portion, a large percentage of serotonin being produced in the gut. And that serotonin has an influence on the rest of our body and the peripheral nervous system. So when there's inflammation or pain, chronic pain through a nerve or neuropathies, and even things like phantom limb pain, there's some really interesting evidence for that. But psilocybin influences that peripheral nerve inflammation, reduces that inflammation, and can be helpful in ameliorating that inflammation and pain. There's studies that have taken a look at cluster headaches. Cluster headaches are notoriously tenacious. They're headaches that happen in clusters, so often very close together to one another. People may not have cluster headaches for months at a time, and then suddenly you have a whole bunch of extremely severe headaches in a very short period of time. They're also notoriously intense. The people have described them as feeling like a red hot poker being stabbed in their eye. Very high degrees of pain, and unfortunately, very high suicide risk rate with individuals with cluster headaches, just because the pain is so intense, and there's not really any established effective intervention for that. So taking a look at that, and there's been some research around psilocybin and how it may be helpful. So you can see in a study that they did with 53 people, they found that it may be useful as a potential intervention alongside other interventions as well. And then the conversation around the gut-brain axis, that relationship between our gut microbiome and the nervous system in the brain. Because psilocybin works on the serotonin receptors, there are a lot of serotonin receptors and serotonin production in the gut. Psilocybin can help establish and support that relationship and that dynamic. Okay, neuroprotection. So now we're going to get into sort of the neurobiology components of how psilocybin influences our body. It's been shown to help protect the nervous system in a few different ways. So it promotes neuroplasticity, including neurogenesis. Neuroplasticity is our nervous system's ability to create new neural connections and have adaptability. So plasticity means being able to be plastic or molded or changed or softened to be able to create those new neural connections. And neurogenesis is the actual generation or creation of new neural connections and new neural cells. So psilocybin induces neuroplasticity, synaptogenesis, and neuroprogenitor self-proliferation. As a serotonin agonist, so increasing the availability of serotonin or working on the serotonin and stimulating the serotonin receptors. It has rapid acting antidepressant properties with the potential to influence other intersecting processes of both major depression and neurodegenerative diseases. So we'll take a look and see on the next slide relationship to different neurodegenerative diseases and how psilocybin has been looked at in that. My previous talk on that include the traumatic brain injury, the acquired brain injury, the stroke, also went through some of the research on neurodegenerative diseases. So if you're interested in that, that material is available as well. Psilocybin significantly increased extracellular dopamine, so it has a direct effect on the body's reward system in an area of the brain called the nucleus accumbens, which has a direct tie-in to dopamine production and how much dopamine there is in our brain. So that comes into play and works with reward circuitry. So feeling rewarded, we get that dopamine hit when we do something that is rewarding. It also has ties into the learning process. So there's a lot of discussion and backing up that psilocybin can influence and help with the learning process as well as the unlearning process, unlearning uh, when it comes to trauma responses and things like that, the ability to step out of those patterns, but also adaptability and learning new skills and perspectives. Depression, pleasure, and motor functions all come into play when it comes to dopamine levels. Psilocybin is also an immunomodulator, so by reducing levels of pro-inflammatory biomarkers, it also has antioxidative effects that directly influence This is 5-HT1A. That just means the serotonin 1A receptor. So a lot of the mechanisms that they took a look at psilocybin for is the serotonin 2A receptor. It does have influences on other serotonin receptors, but not as strongly. So serotonin 1A receptors happen to be what most of our antidepressants, our SSRIs, SNRIs work on. And so slightly different mechanisms and how they influence the body. But psilocybin does influence that serotonin 1A receptor, and through that mechanism has antioxidant effects. It's also, as we talked about before, anti-inflammatory effects directly on the brain and the central nervous system. And then when it comes to neuroplasticity, neural connectivity, and neural communication, there's quite a bit of research and really intriguing information. I know that this is kind of an info-heavy slide. Um, Tried to parse it down, but all of this is I feel like really important to have an understanding around if you want to know what psilocybin is doing in our body. So it influences or it enhances neuroplasticity and the neurogenesis or neuritogenesis through mechanisms called TrkB or TRKB and mTOR or mammalian target rapamycin receptors. So that's sort of the mechanism by which neuroplasticity is improved or increased. And it also influences neurotrophic factors like BDNF, which is brain-derived neurotrophic factor, which is a real key mechanism in neuroplasticity and the adaptability of the nervous system. Working on the serotonin receptor as well is also associated with increases in neuroplasticity and can play an important role in the control of what's referred to as thalamo-frontal connectivity that's been demonstrated to be an important component of just consciousness and our sense of awareness. So thalamo frontal means an area of the brain called the thalamus, which is a key relay station in our brain. It's the area of the brain where most of our incoming sensory information comes. So all of our five senses, that information goes to the thalamus. It sort of processes that and shunts that information to different places depending on what needs to be done. And that relationship with the frontal lobe, which has to do with our higher cognitive functions and executive function and decision and judgment making, and multitasking and all of those things. So that dynamic has been shown to be directly influenced by psilocybin as well. It's also been shown to lower the action potential threshold in an area of the brain called the hippocampus. The hippocampus is our memory center. So there's this direct tie-in of how psilocybin influences the memory center of the brain. And by lowering the action potential threshold, what that means is that the neurons are firing faster. So there's more information being processed, and the processing is happening more efficiently in the memory areas of the brain, which allows for what they refer to as functional plasticity, so adaptability because things are moving at a faster rate. Psychedelics can stimulate neuroplasticity through what are called microglia and regulation of the microglia. Microglia are tissue-specific, self-renewable central nervous system macrophage-like cells. So what they do in the brain is basically they're the scouts that move throughout our brain tissue and look for things that shouldn't be there. Look for problems, and if there are problems, then they eliminate those problems. So they will kill off bacteria or cells that don't belong, or if there's like cells that are regenerating beyond what they should be, and it's a potential cancer risk or something like that. These microglia are the cells that are on high alert to look for those things and eliminate them if necessary. So by modulating or working with the microglia, psilocybin provides a significant increase in integration between different areas of the brain. Or the microglia reveals disruptions in normal organization of the brain. So it finds where there may be issues in the tissue and helps clear that out. So psilocybin helps influence that. Psilocybin also provides a significant increase in integration between different areas of the brain, so different cortical regions, and allows for more diffuse information or diffuse communication or communication globally throughout the brain itself. So a lot more of the brain is talking to itself than what would normally happen. It's also been shown to decouple and desynchronize what's referred to as the default mode network. If you've looked into psilocybin and some of the neurological research, there's a lot of conversation around its influence on the default mode network. And especially as it ties into breaking out of patterned behaviors or patterned thinking. So, like with depression, we get in these loops of negative thinking, and it can be very difficult to step out of those. And these sort of loops happen in a lot of different facets of how we navigate the world. And those things tend to be tied into the default mode network, which is a brain network associated with resting states. So, kind of what our brain is doing on autopilot most of the time, as well as introspection. So, thinking inwardly or thinking about ourselves, and especially ties into one's sense of self or the ego or personal ego. And so when people have the transcendent mystical experiences where they'll describe ego death or ego dissolution, there's a neurobiological mechanism or basis for that where they can see that when that is happening, there's the default mode network basically temporarily goes offline. It deconnects it or unplugs it from the emotional centers, the limbic system, and that's what allows for a lot of the change and an opportunity. You can relate it to unplugging your computer and plugging it back in. It kind of takes things offline and then comes back online after the journey itself or after the psilocybin experience. And because of that, there can be an opportunity to look at things from a different way and break out of those cycles that can be self-perpetuating otherwise. It also has been shown to switch off the anterior cingulate, an area of the brain that's associated with the experience of suffering. So there's a difference between how the brain processes pain and how the brain processes suffering. And so you can experience pain, a sensory experience, without experiencing suffering. And you can experience suffering without any physical pain. And so psilocybin has an influence on this area, the anterior cingulate, that has to do with that subjective experience of suffering. And by doing so, that allows, when it comes to things like depression, those depressed individuals to experience relief. They're not experiencing it as impactful, and it can sometimes be an opportunity just to see that that's possible, to be able to step out of that cycle of suffering that people can so easily get locked into. Psychedelic states are also considered an exemplar of what's called a primitive or a primary state of consciousness. So interestingly, primary states, what they refer to as primary states, involve an increased entropy. So entropy is the natural tendency of things to break down or turn over. So when you're introducing, like Robin Carhart Harris is a prolific researcher in psilocybin research, and he has multiple papers, but one that really digs deep into the entropic brain theory and the idea that how psilocybin introduces entropy, or it's introducing new information, or it's introducing novelty, and it's introducing the ability to break down rigid patterns of thinking and physiological processes and things like that. So psilocybin, in some conversations, are considered uh, to be introducing entropy into the system that allows for change. So these primary states are also considered states where there's more entropy, there's more turnover, there's more potential for change. Um, and that the primary states function as a critical point in a transition zone between order and disorder. So, being a critical state, that also means sort of an optimal state of functioning of our brain and our nervous system and our thought patterns. So if primary states are critical, what that suggests is that entropy is actively suppressed to some degree in our normal waking consciousness as we're navigating the world in everyday consciousness. The entropy may be suppressed. The brain is always constantly doing a lot of filtering of sensory information in our experiences. So there's a lot more going on than what our brain is actively processing. And so a lot of the functioning of the brain is to inhibit the information that it doesn't consider worth paying attention to. So there's a lot that we miss. There's a lot that we experience. An easy way to think about that is there are different animals that have wider spectrums of perception than we do. Bees can see in UV. There's just a lot that our nervous system actively filters out. And the argument here is that our brain may also um, filter out um, levels of entropy as well. So, what that means is that most of the time in daily living, our brain is operating below its optimal ability to do so. And so, entropy suppression furnishes normal waking consciousness with constrained metacognitive functions. So what that means is our metacognition is the ability to think about or reflect on the way that we're thinking and be able to initiate change in that or recognize where change might be warranted or just have an increased awareness of around how we're building our maps of reality. And that includes reality testing and our self-awareness, our overarching awareness of ourself and how we're operating. And that can be how psilocybin helps increase our ability to do that, is it's introducing a more entropic state of being, and a more entropic state of being may be associated with a more optimal way of operating within our brain, our nervous system, and our ability for self-awareness and self-change. All of this talk around neurogenesis, neuroplasticity, they've done research and taken a look at doses and how different doses influence that. And what they found is when it comes to neuroplasticity, the adaptability component, low doses, microdoses, mini doses showed an increase in neurogenesis and neuroplasticity, whereas high doses actually showed a decrease in neurogenesis. So they've shown that there's more neuroplasticity that happens with microdosing and low doses, and that the higher doses are associated with more of the global connectivity where different areas of the brain are caught talking to one another where they didn't talk to each other before. So with the study that they did, taking a look at neuroplasticity, comparing low doses to high doses, they injected mice with low doses, um, or those who were given the low doses, and then they did a test for fear conditioning. So what they did was they it's similar to Pavlov's dog. They did operant conditioning where they conditioned these mice to have a response to um, food being given and created an association with an electrical shock. So uh, as this was happening, the mice would receive an electrical shock, and then over time they figured out that the test was associated with getting an electrical shock, so they didn't want to perform that activity. And then they gave the mice psilocybin, both at high doses and low doses, and worked to untrain that operant condition, that fear response. So they no longer associated the food with electrical shock and paid attention to how many times it took the mice to sort of realize and uncondition themselves or unlearn that behavior to where they again felt safe getting the food. And the unlearning process was significantly faster in the low dose. So I think it was 10 times. It took 10 times for the mice on the high dose of psilocybin or without psilocybin, and it took 2 times on the low dose. So the mice learned that behavior or unlearned that fear response a lot faster. So, um, so what is a microdose? Microdose is a very low dose of a psychedelic substance. It's usually associated with psilocybin or LSD, but I've heard conversations around microdosing of other psychedelic substances as well, MDMA, ketamine, which isn't technically a psychedelic substance but has psychedelic-like effects. But usually, when you're talking about a microdose, it's an association with psilocybin or LSD. That's just where most of that conversation and certainly research has been. So a microdose is a very small dose of a psychedelic, so small that it's considered subperceptual or subhallucinogenic. So it's below the threshold of any sort of intoxication. It's below the threshold of any sort of functional impairment. You can continue to go about your day. You're not in any sort of altered state of consciousness. People do still have sensations. Often with microdosing, it's usually rather subtle. So it can just be feeling better. It can be feeling good, or it can feel like a veil or a fog has been lifted. So things can just tend to have more clarity, or there can be a slight amplification of sensory experiences. So things can seem just more bright or vibrant. Music, light, art. Um, but like I said, you're not functionally impaired in any way, and it doesn't change necessarily um, the way that you're thinking significantly either. So usually a microdose is considered about 1/10 of what would be considered a standard psychedelic dose or a therapeutic dose. So with psilocybin, that is about between 1 and 5 milligrams of psilocybin analyte, which is roughly zero point 0.1 or zero point 0.5 grams of dried mushroom. So with the legal framework in Oregon, the way that psilocybin is distributed and dosed, it's in milligrams of psilocybin analyte. So we're able to have every batch is tested to make sure it's exactly what it is, says it is, and also we can see exactly how much psilocybin is in each batch because that can vary by batch. It can vary by a varietal or subspecies. And so we can be much more consistent with dosing by dosing according to the actual psilocybin content. And so when we do dosing in that framework, it's 1 to 5 milligrams. With LSD, it comes out to about 5 to 20 milligrams or so, whereas with LSD, a mini dose is considered 25 to 50 micrograms. So very small dosing here. And the ideal effect for a microdose has been described as when you feel good, you're working efficiently, and that you've forgotten that you've taken anything at all. And that's a quote from Fadiman and Korb. James Fadiman has done a lot of work with microdosing. We'll see more of his work in just a second. But that's really sums it up quite well. You forget that you've taken a substance. You don't really feel any significant effects. Um, but you're able to go about your day, and a lot of people have reported using microdosing to help with creativity or myself found it very helpful in working through some grief during difficult times of my life. And so uh, it's not anything that's going to change the course of your day where you need to necessarily accommodate it, but can be supportive in just feeling a little bit lighter or a little bit better or a little bit more aware or a little bit more creative. So there are a couple different protocols or ways to go about microdosing that have been discussed. One of those is what's referred to as the Fadiman protocol. So again, James Fadiman, his recent book came out in 2025, Microdosing for Health, Healing, and Enhanced Performance with Jordan Gruber. Both fantastic individuals I've had an opportunity to correspond with, and highly recommend the book. The Fadiman protocol is basically dosing every 4 days. So as you can see here, you would take a microdose for day one, and then you would take 2 days off where there's no microdosing at all to reflect and reset. And on day 4, you would then dose again. So it's this 4-day cycle. And there's no defined number of cycles with which somebody is considered that you would want to microdose within those cycles. Many people who have done this on their own have reported that they'll continue the 4-day cycle for about 10 cycles or so. And at the completion of the 10 cycles, uh, you have sort of built a relationship and an understanding of how microdosing affects you and works with you, and then can have an informed decision about whether to continue, whether or not to take a break. And we'll talk about taking a break and why that can be really important in just a bit. But that's the Fadiman protocol. There's also the Stamets protocol. So the well-known mycologist Paul Stamets has also talked about microdosing a fair amount. And the way that he approaches microdosing is where you cluster the microdoses several days in a row. So it's a 7-day cycle, a weekly cycle. And within that week, you do days 1 to 4, you're microdosing each day. And then days 5 to 7, there's no microdosing. There's no psilocybin. But he builds into this, into microdosing, the conversation of stacking, and this is going to be the bulk of what we're going to talk about for the rest of today is stacking and pairing other substances with psilocybin to help support what psilocybin is doing. Yeah. And so with the Stamets stack, as it's been referred to, it includes pairing psilocybin with lion's mane mushroom and niacin. And that cycle, that 7-day cycle, is usually continued for 2 to 4 weeks. When we do our microdose intensives at our service center, we'll do it for a period of 2 weeks and then give at least 2 weeks break before somebody may consider doing another 2-week cycle. Um, and then you can, under the Stamets protocol, you can continue the lion's mane long term if it seems appropriate. That well, let's talk a little bit more about the Stamets stack first. So the stacking again refers to combining multiple substances that work synergistically together, so they work within one another. The having them used in conjunction is having has more effect than taking each one of those individually. So the Stamets stack, as I said, includes the microdosing of psilocybin, which he lists as 1 to 10 milligrams of psilocybin or zero point 0.1 to 1 gram of dried mushroom, paired with 500 to 1,000 milligrams of lion's mane mushroom. And we'll talk about the benefits of lion's mane separately. We'll dig into that even deeper in just a little bit. And then 100 to 200 milligrams of niacin or vitamin B3, which has been included to increase vasodilation and also known to carry GABA across the blood-brain barrier. And again, we'll talk about that just a little bit more. But that's what's considered a Stamets stack. And a little bit more about microdosing as a whole before we move into conversations around stacking and other options you might consider in stacking or in complementing or supporting the neuroplasticity that psilocybin can induce. So commonly reported effects of microdosing can include more energy, more creativity, clearer thinking, an increased problem-solving ability, increased focus, increased awareness, a positive mood or just a more elevated mood, greater emotional connection with people around you. And we talked about that empathy component, and that has been found or reported with microdosing as well. And also just being more present in the moment. So it's been called flow states, where people just get in the flow of things and work very efficiently and right there in the moment and able to be attentive and pay attention and do what needs to be done and be there in the present moment. Microdosing has been shown to be helpful in that. So potential risks of microdosing. Again, Fadiman and Korb took 1,850 reports of people who had done microdosing. Of those, 75 people, or less than 4% expressed that they did not have a positive experience with microdosing. So very small percentage, um, but it does happen. So worth having a conversation around, worth mentioning. A biggie here is that first bullet, valvular heart disease risk increase with long-term use. And this is the reason that when it comes to microdosing, breaks are very important. So we talked about how psilocybin influences different types of serotonin receptors, mostly serotonin 2A. We talked about serotonin 1A. It also impacts serotonin 2B. And the there's limited research on it at this time, but long-term stimulation of serotonin 2B receptors have been associated with an increased risk of valvular heart disease. This isn't problematic when it comes to a large dose of psilocybin that you only take once, and then your body has a chance to, it doesn't have the chance to accumulate that risk. With microdosing, the reason that we integrate breaks in and don't microdose on a daily basis long term is because that long term stimulation of the serotonin 2B receptor has been associated with this increased heart risk. So it doesn't seem to be a problem as long as those breaks are built in. But it's important to be aware of because there are people who will recreationally or informally be microdosing, and I've heard reports of people who have microdosed on a daily basis for a couple years at a time, and that definitely runs its risk, and I want to make sure people are informed about that. Sometimes with the microdosing, people can experience, again, these tend to be rare, but there can be an increase in anxiety or paranoia if somebody's prone to paranoia. Again, this is part of the overarching conversation. If somebody is interested in pursuing psilocybin, is how prone somebody may be to those, and whether or not it may be appropriate or whether or not a macrodose might be more appropriate to sort of break out of those patterns. There can be increased emotional stability where in those who tend to experience intense emotional distress, like grief. And I said of my own personal experience, after my parents' passing, was working through processing a lot of grief, and it was very helpful. But for a small portion of the population, it may increase the emotional instability. There can be some mild stomach upset or nausea. There are ways to help prevent some of that. So at our service center, we always have ginger chews. We recommend if you know that you're prone to nausea, eating a banana beforehand. Bananas contain an enzyme that helps break down the psilocybin cellular structure, and a lot of the stomach upset nausea can be an issue of digestion. So there are certain parts of the mushroom that our body has a hard time breaking down and digesting. If we can help that along, as simple as eating half a banana beforehand can really help reduce the chances of stomach upset or nausea. There can be fatigue, there can be difficulty sleeping at times because people will feel energized or more engaged. Some people will develop headaches, again, rare, but does happen. It's reported that tinnitus may get worse, so ringing in the ears. Paul Stamets has reported having people actually have improvements or resolving tinnitus, which historically has a history of being a really stubborn thing to treat. I treat a lot of people who have history of concussion or traumatic brain injury and have tinnitus and struggle with that, and it can be a difficult one. So jury's kind of out, or it may vary depending on individual biochemistry on how the tinnitus is affected. People diagnosed with bipolar disease have been reported that they benefited from microdosing during their depressive phase, but would discourage it during a manic phase because psilocybin can exacerbate mania, or yeah, it can exacerbate mania. And then they found a tolerance buildup with LSD microdosing. So they've taken a look at if you're microdosing for an extended period of time, is there a tolerance that gets built up where your body is not responding? They did find At least in this Bowman study, when they took a look at it, that with LSD there was a tolerance that built up, so the dose was not having the same effect over time, but that was not found in psilocybin. I would hazard a guess that's because psilocybin is metabolized so fast in our system that uh, that it doesn't turn into a problem. Now, of course, there's individual metabolism rates, so that might vary from person to person. But in my personal experience, both myself microdosing and the microdosing that we do within the center, we haven't found any sort of tolerance by doing the Stamets protocol, which is how we usually build that out, where they're microdosing 4 days in a row, taking 3 days off, continuing to support over those 3 days with other interventions, other things that help support the neuroplasticity, and then microdosing another 3 days and then another 3 days off. So we already talked about brain-derived neurotrophic factor, just that that's a key driver in neuroplasticity. So there's research taking a look and showing that microdoses of LSD did indeed still increase BDNF in the body. So it's not just with a macrodose, that microdosing it does this as well. Same thing with the neuroplasticity and the fear extinction. This is the mouse study that I was talking about. Um, the tie-in with an auditory tone that was associated with food, and then that being followed by an electrical shock and that unlearning process. It was 10 rotations or 10 times for those with a full psilocybin dose to unlearn that behavior, and with a microdose, it only took two. So Paul Stamets talks about this and says that microdosing is feeding the neural receptors. It's stimulating that on a low level rather than flooding the receptors. Um, the way that a full psilocybin dose does. And by feeding it rather than flooding it, that learning or unlearning process is more efficient or more effective. They've also taken a look at microdosing in terms of how it impacts the amygdala, that emotion or fear center in the brain, and the DMN, the default mode network. This is just to show that it has been shown that microdosing, as well as macrodoses or larger doses, does indeed also have this effect on the amygdala and the default mode network. And then another really interesting one, at least to me, as a clinician and somebody who works in integrative neurorehabilitation with a lot of individuals who have neurotrauma or neurodegenerative diseases, is a tie-in between microdosing and a finger tap test. This is where you just tap your finger on a table, or the way that this was done, it's on your phone screen. So there's a informal study that you can go to and you can check out the data for, or you can participate, called microdose.me. You just go online and type in microdose.me. And it's people self-reporting their microdose experience. So it's an app that you can download. It has a number of different tests, including cognitive tests and things like that. You put in the information of what your microdosing protocol is, what that looks like, and what your experiences are. And one of those tests that they've included in the app is a finger tap test. So you tap on your phone screen and for a period of time, and it analyzes and pays attention to how many times you tap the screen. There are app games like that too, where you can kind of like test your finger tap speed and things like that. But this analyzed the data and showed that there was an improvement in finger tap speed over time with people who were microdosing and stacking with lion's mane and niacin. And so for me, this is really significant because finger tapping is one of those things that tends to slow down when the central nervous system is affected, and especially with things like brain injury, Alzheimer's, and neurodegenerative diseases. So finger taps slow down over time as our brain is not firing as efficiently and effectively. And especially with neurodegenerative diseases, it's considered degenerative. It's not going to get any better. It's not going to improve. And so by seeing an improvement in the finger tap test with microdosing paired with lion's mane and niacin, that is something that statistically should not really happen. And it's demonstrating more activity, more flexibility, and a learning and demonstrating that our brain is making new neural connections and working more efficiently. So as a clinician, this one is really significant for me. It's an objective measure where we're seeing improvements in how the nervous system in the brain is actually functioning. So why is niacin included in the stacking protocol that Stamets talks about? It's primarily in there as a vasodilator, so it dilates the blood vessels. It allows for better circulation. So in the patent that Stamets has put together with this stacking protocol, which is a whole other conversation around patenting natural medicines and substances, but in the patent, the justification for niacin, it airs and recommends true niacin or nicotinic acid because it causes a flush in the body when you take it. So you feel flush. It's described as a harmless but uncomfortable feeling of warmth, redness, itching, or tingling on the face, neck, and chest. As circulation increases, you get this flush. It can be rather uncomfortable, and it's usually associated with doses above 30 milligrams. If you recall, the recommendation of niacin in the statement stack is 100 to 200 milligrams. So, again, quoting from the patent here, the flush is hypothesized to act as a delivery system, helping the beneficial compounds like nerve growth factor from lion's mane and the psychoactive properties of psilocybin and microdosing to reach the farthest reaches of the nervous system. So the idea is dilating the blood vessels so that the medicinal properties of the psilocybin and the lion's mane is able to get to as much tissue as possible. Also, niacin is known to be a neural anti-inflammatory and in itself has been implicated in improving neural functioning. As niacin activates the nerve endings, niacin contributes an added benefit by enhancing the neurogenic effects of psilocybin. Psilocin is the metabolite of psilocybin. So, when we consume psilocybin itself in humans is not psychoactive. It's not psychoactive until our body breaks that down, which is why there's a period of time when somebody ingests psilocybin before they actually feel any effects. So our body needs to break it down, metabolize it, and convert it into psilocin. So psilocin is the metabolite of psilocybin. It's what's actually psychoactive and what allows for a trip or the functional change in an altered state of consciousness. So it enhances the neurogenic effects of psilocybin, psilocin, and lion's mane. And by helping these nootropics cross the blood-brain barrier and mitigate throughout the nervous system and to its endpoints. Also, niacin being a vasodilator, it improves blood flow in the brain by relaxing constricted blood vessels. So I want to introduce some ideas on why you might reconsider integrating niacin into stacking, and then we're going to take a look at a number of other substances and nootropics that you might give consideration to and reasons for that. So niacin is in a lot of food. It has a recommended daily allowance or dietary allowance, which is 14 to 16 milligrams a day of niacin within your food. So again, the flushing tends to be associated with above 30 milligrams. In the statement stack, the recommendation is 100 to 200 milligrams of niacin. There are some associated cautions and risks with high doses of niacin and continued use of niacin long term. One of those, and arguably the biggest, is liver damage. So it's considered one of the most serious risks, especially with high doses. Admittedly, most of the arguments around where liver damage starts to happen is also significantly higher than the recommended dose in a stack. I've seen everything from 1,000 milligrams to 2 or 3,000 milligrams. But those who already have liver issues, it may be complicating. Um, there are cautions and risks around gout. So niacin can increase uric acid levels in the blood, which can exacerbate or lead to gout. It increases blood sugar or glucose levels, which can be problematic for people with diabetes or pre-diabetes. There can be associated gastrointestinal issues, so upset stomach, nausea, vomiting, diarrhea, and it can also exacerbate peptic ulcers. Lowers blood pressure, so hypotension, where you can experience dizziness or an increased risk in falls. Psilocybin temporarily increases blood pressure a little bit, and so within the relationship of stacking, that's usually not too much of an issue. Increased bleeding risk and can lower the number of platelets in the blood, cardiovascular events. There's been recent research that has linked excessive niacin intake with an increased risk of heart attack and stroke. And for that reason, most experts prefer to use what are considered safer alternatives when they are working with cholesterol management. Niacin has been used and prescribed for regulating cholesterol and managing cholesterol in the past. They're moving away from that because of that associated increased risk of heart attack and stroke. And then it's rare, but some people have allergic reactions to niacin as well. So, um, contraindications and interactions. It's recommended not to take high doses of niacin without consulting a healthcare professional. And niacin should be used with caution or avoided in individuals who have liver disease or um, existing liver issues, peptic ulcers, low blood pressure, gout, diabetes, or history of bleeding problems. Niacin can also interact with several medications, including statins, blood thinners, blood pressure, and diabetes medications. And alcohol consumption should also be limited if somebody is taking niacin, as it can worsen the side effects and increase the risk of liver damage. So, and also the flushing. While the flushing is not considered a health risk, it can be rather uncomfortable. And while the argument with this within the stack is that that is an indicator of vasodilation, it's an indicator of increased circulation. It's not the most pleasant thing in the world, and and I certainly don't enjoy it. And there are other ways and other means of dilating the blood vessels without getting that flushing effect, and we're going to talk about some of those. So we're going to talk about other ways to possibly stack, other things to give consideration to that might be supportive in microdosing and supporting neuroplasticity, why each one of those are. And this is a tincture blend that I have made and is commercially available that integrates in everything that we're going to talk about in just a little bit. So it's all of the different nootropics and um, other supportive substances in one place. So we're going to kind of break that down and go over each one of these and why they may be helpful and why I've integrated them into this. And they may be given consideration on their own merits as well as within the relationship of how they work together. They are designed and dosed in a way that they are mutually supportive and they work in a synergistic way. So I'm going to move my little head here on my view so that I'm not blocking my own slide and I can read all of the material. The first is lion's mane. Lion's mane is a medicinal mushroom with a wide range of benefits, especially for the nervous system and the brain. It is one that Paul Stamets includes in his stack. It supports neuroplasticity very directly on its own, supports neurogeneration, has an impact in improving memory and thinking, promotes nerve growth and healing. This is both neurons in the brain and peripheral nerves within the body. So if there's nerve damage, it's been shown to speed that process up. It supports dopamine levels, it's antioxidant, anti-inflammatory, and it's also an immunostimulant. So it helps build up the immune system and has an positive effect on gut health as well. So it helps with that gut-brain dynamic and supporting that gut-brain axis also. So for each one of these, I've included the scientific name, other names that it goes by, and each one of these is also described within Chinese herbal medicine. So my background, my doctorate is in traditional Chinese medicine and Chinese herbology. So I've included the Chinese medicinal name. I haven't included all of the Chinese perspectives on how they look at the herbs, but there's information about that available. There's a mention of my book at the end of this, and that goes into the Chinese indications as well as everything that's included on these slides. So if you want to dig deeper into it, that's available. But for each one, I've included the key actions. So lion's mane is an adaptogen, which means it helps with stress management and allows the body and us to respond and adapt to situations faster and more efficiently. Produces nerve growth factor, or NGF, supports myelination. This is really big in neurodegenerative diseases, things like multiple sclerosis in particular. Antioxidant, antiviral, antibacterial, and immunostimulant. It's anti-inflammatory and it's a diuretic. So you can see all of the different things that lion's mane may potentially be helpful for, including things like improving cognition, memory, concentration, neurofatigue, things like Parkinson's, multiple sclerosis, neurodegenerative diseases. That's just on its own. Um, so this can be and has been historically through the Stamos stack paired with psilocybin very effectively. Another mushroom that can be supportive of the process is turkey tail. Turkey tail mushroom has a wide range of benefits as well. Um, More focused on the immune system and the gut-brain axis than lion's mane is. But turkey tail has synergistic properties with lion's mane and ginkgo, and we're going to talk about ginkgo next, I believe, or on one of these slides. Turkey tail is also antioxidant, it's anti-inflammatory, it's also an immunostimulant. But because of this synergistic property with lion's mane and ginkgo, it pairs with those very well and helps support that whole process in supporting the nervous system and regulation of the nervous system and the neuroplasticity. Ginkgo biloba, there's a lot of research out there around ginkgo and its effects on the brain and all of the positive benefits that it can have on memory. Ginkgo increases cerebral blood flow, so it's increasing the blood flow to the brain. It's been shown to be helpful in memory, improving focus and attention. It's also antioxidant. Also anti-inflammatory. It's neuroprotective, so it protects the nervous system. It protects the neurons. And it's also a vasodilator, so that increasing the cerebral blood flow. Um, a very different mechanism from niacin, but this is a natural vasodilator that will improve blood flow to the brain, which is how it can be helpful in the cognition support and working with things like dementia. And You can see cerebral ischemia over here, situations where the blood is not getting enough, or the brain is not getting enough blood. Green tea. Green tea has been shown to have a lot of different benefits for the brain and the nervous system. It supports concentration, attention, and working memory. It protects the nervous system, so it's neuroprotective. L-theanine is a common supplement that you can pick up most places that have supplements that sell supplements. And L-theanine is a green tea extract, so it's taking one of the um, key chemicals in green tea, extracting that, and then you can buy that as a supplement on its own. L-theanine supports serotonin. It's also very calming for the nervous system. When I'm working with people with a lot of trauma or people who are prone to generalized anxiety or panic attacks, L-theanine is a common supplement that I'll work with somebody as a standalone or built into other um, recommendations, but it can be really helpful in calming the nervous system. So I'll have people sometimes be taking L-theanine as an ongoing lower dose as a daily supplement. And those who are prone to panic attacks have that on hand to increase the dose. It's a very safe supplement. Green tea is processed really easily through the body. There's not much risk of side effects. And so it can be also used as an intervention if somebody feels like panic is beginning to come on. So, um, so L-theanine supports serotonin, dopamine, and GABA levels. GABA is a key inhibitory neurotransmitter in the body. So when it comes to calming the nervous system and down regulating the nervous system, GABA is often in play there. It's the big down regulating neurotransmitter. It's also highly antioxidant, highly anti-inflammatory, and anxiolytic just means that it helps reduce anxiety. So you can see neuroprotective, antioxidant, anti-inflammatory, anxiolytic. It also has been shown to help induce alpha wave activity in the brain, which puts the brain in a more restful or concentrated or focused state. So alpha waves are associated with concentration or meditation and focus. And it easily crosses the blood-brain barrier. That was one of the things that were discussed around niacin is that it helps sort of guide the lion's mane and the psilocybin through the blood-brain barrier more efficiently. Green tea readily crosses the blood-brain barrier. It can also have this mechanism, and we'll see a couple other substances that do that as well. Next, we have Bacopa. It's also often called Brahmi. And Bacopa helps support learning, memory, word recall, mental processing. It also downregulates anxiety, so it's an anxiolytic. It's neuroprotective, protecting the nervous system and the neurons, antioxidant, anti-inflammatory, and promotes dendritic branching. So the dendrites of the neuron itself, this Bacopa helps promote that branching out and making those neural connections a little bit easier. So you can see neuroprotective supports memory and learning. It also has anti-aging properties, anti-anxiety, antioxidant, anti-inflammatory, and improves digestion. So a lot of the applications here, when this is used as a standalone supplement or built into other supplement regimens, is mostly to support memory, learning, um, and there's some evidence as far as being helpful in neurodegenerative diseases like Alzheimer's disease and with things like ADHD as well. Closely related to Bacopa, and both of these are often used. Bacopa and Gotu kola are often used more in Ayurvedic medicine and herbology. And there's a lot of overlaps in terms of their benefits, but they work in slightly different ways. And so they can be also used, those two together have a synergistic relationship as well. So Gotu Kola is a supplement that supports memory, cognitive function, and focus. It's also neuroprotective. It's also antioxidant, anti-inflammatory, and anti-apoptotic. So apoptosis is the process of um, predetermined cell death. So each of our cells in our body have a certain lifetime, and when appropriate, those cells are supposed to die off. And if they don't and they continue to regenerate and grow, that's called cancer. So apoptosis is a really important built-in mechanism to help prevent that, but also if there's damage to the nervous system, apoptosis can get out of control, and we have too much cell death happening, especially after things like stroke or brain injury, where we have damaged tissue. We can the inflammatory cycle that can perpetuate after that has too much apoptosis going on. We have too many cells that are dying off unnecessarily, and so Gotu kola has been shown to help regulate that mechanism. So again, go to cola, neuroprotective. It's an adaptogen. It's antioxidant, anti-inflammatory, anti-apoptotic. It boosts collagen and also improves circulation throughout the body. So it's often used or recommended for cognition support, memory support, stress management, and lowering anxiety. Depression, insomnia, you can see joint pain with that anti-inflammatory effect and wound healing and skin conditions, things like eczema and psoriasis, and also helping with microcirculation, which is circulation um, through the capillaries of the body, the very small blood vessels. Which again, when it came to the conversation around niacin in stacking with microdosing, part of that, the reason that that was built in was to improve uh, vascular dilation and circulation, and Gotu Kola helps with that microcirculation throughout the body as well. Next, we have Acorus. This is a Chinese medicinal herb that I love this herb. Working with a lot of neurological conditions, I tend to integrate this into a lot of recommendations or herbal formulas for people. So Acorus crosses the blood-brain barrier very efficiently. And by that same principle that we talked about before, it too can act as a carrier herb or an herb or a substance that helps other substances cross through the blood-brain barrier more efficiently. It also helps clear out phlegm. It's said to help clear the brain or sort of lift that veil that we had talked about when it feels like there's brain fog or kind of a filmy, phlegmy um, feeling to our thinking process. So when thinking is unclear, it also supports memory. It's great at free radical scavenging. It's neuroprotective. It restores antioxidant states and reverses neurotoxicity. So if there's a state where we have a neurotoxic environment, there's been some sort of exposure to any sort of neurotoxin, aqueous can be very helpful in reversing the effects of that. So it's neuroprotective. It's helpful in enhancing cognition, so allowing for better memory, more clear thinking. Um, Often use this with brain fog, antioxidant, anti-inflammatory, anti-fatigue, anti-convulsant properties. Helps with mood regulation. It does have a slight down regulating effect. So it lists it as sedation or as a hypnotic, but really it helps down regulate and shift the nervous system into a more relaxed state, which can allow it to also be much more receptive um, to other experiences and in relation to the microdosing to that microdosing experience. Antispasmodic, antimicrobial, it's an expectorant, and it also as I mentioned, very readily crosses the blood-brain barrier. So often we'll use this as a carrier anytime that we're working with the central nervous system, anytime that we're working with the brain. So a lot of the potential uses have to do with neurological condition, general weakness, stroke, Alzheimer's, neurodegenerative diseases, concussion and traumatic brain injury, anxiety, depression, stress management, etc. You can see a lot of respiratory and digestion indications in there as well. Polygala is another Chinese herb that I also absolutely love and often pair with Acorus. So Chinese medicine, Shi Pu and Wan Shi, fantastic combination when it comes to neurological conditions and working with the brain and supporting the brain and the nervous system. Polygala calms the mind, it calms the nervous system down, it supports memory and cognition. So it's been shown to have a very direct effect on improving cognition and our ability to think and learn. It reduces restlessness, increases nerve growth factor, which is really important in neuroplasticity. So it in itself has neuroplastic benefits, as well as brain-derived neurotrophic factor. Again, this is a key mechanism in neuroplasticity. It is also anti-apoptotic. It has an acute antidepressant effect as well. So Polygala is really interesting to me, at least in this regard, because the mechanism by which it has an antidepressant effect is very, very similar to the same way that ketamine has an acute antidepressant effect. So, antidepressants, your serotonin SSRIs, SNRIs, that are working on the serotonin system, they tend to take several weeks before there's any sort of expectation that there will be any sort of significant lifting of depression. Polygala and the mechanism through which both polygala and ketamine have been shown to have an antidepressant effect is nearly immediate. It's very acute, it's very fast. And there's no altered state of consciousness. There's no impairment. There's no dissociative effect with polygala. If anything, there's an anti-dissociative effect in that we tend to be more present. Our brain tends to be more active, more cognitively engaged with polygala because it helps support all of those things. So, big fan of polygala overall as a standalone, as a pairing with Acorus, and certainly in support of microdosing and the nervous system as a whole. So, also neuroprotective, increases or enhances cognition and learning, improves neuroplasticity on its own. It's an antidepressant, anxiolytic, so it helps reduce anxiety, antioxidant, anti-inflammatory. It's also an expectorant and also helps with that apoptosis, regulating cell death, making sure that that's not happening too soon because of inflammatory processes, or that cells are not overly proliferating so that they're dying off at appropriate times. So often used for helping support cognition, concentration, focus, brain fog, dementia, neurodegenerative diseases, depression, anxiety. Can also be helpful because of its calmative effects on the nervous system for anxiety or insomnia, restlessness, and palpitations. Faux tea or Hushuwu is another herb that's neuroprotective. It's an adaptogen. So again, it helps with our body adapt to or navigate stressful situations. It's antioxidant. It nourishes, Chinese medicine is considered to nourish the essence of the body. So it's very deeply tonifying or nourishes the body at a very foundational level. It has anti-aging properties. It's actually stimulates the central nervous system, inhibits monoamine oxidase, which has an influence on neurotransmitter, and it's neuroprotective, an adaptogen, anti-aging, antioxidant, antibacterial. It enhances the immune system. It regulates cholesterol, and it helps protect the liver and the kidney. And we'll see this in a couple of the herbs that we'll go over here. When we were talking about niacin in stacking, especially when it came to large doses or continual use of niacin, that there was this risk of harming the liver and liver damage. And we'll see a couple of these that we're talking about actually help protect these organs. In this case, the liver and the kidney both. So this is often used in cases where, because it's so nourishing for the body at a foundational level, when there's general weakness or general debility, or really worn down, the immune system is really low. It's also used in neurodegenerative diseases like Alzheimer's and Parkinson's, in cholesterol support, constipation, insomnia, dizziness, low back pain, knee and joint pain, perimenopausal symptoms, and hair health. The Chinese name He Shi Wu translates to the black-haired Mr. Wu. It's a nod to how this herb has been used for hair health and graying and brittling hair as people are aging. So helping prevent that and maintain your luscious, healthy hair into old age. Skullcap is anti-inflammatory, it's neuroprotective, it supports blood-brain barrier integrity. So whereas some of the other herbs we were talking about easily cross the blood-brain barrier, that's referring to a healthy blood-brain barrier. Blood-brain barrier is very important in making sure that things don't get to the brain that aren't supposed to get there. So bacteria, anything that's going to be harmful for the brain, the blood-brain barrier acts as a barrier, as a protective mechanism, so that those things don't compromise our central nervous system and compromise our brain. Skullcap has actually been shown to be helpful in rebuilding and strengthening and supporting the blood-brain barrier when that's compromised. This is something that can show up, especially with neurotrauma, concussion, brain injury, stroke, things like that. There's also a really interesting relationship. We've been talking about that gut-brain axis, and how those things work together and communicate to one another. And we've talked about the relationship between gut serotonin and serotonin in the brain and how they're produced separately, but have a relationship with one another. There's also a relationship between the blood-brain barrier and our gut lining. So if often after neurotrauma, when the blood-brain barrier is compromised, the gut lining will also become compromised or hyperpermeable. So we'll get sort of a leaky gut where things that are supposed to stay in our digestion tract leak out. It's also compromised. And by the same token, working on and supporting the gut lining can be supportive for the blood-brain barrier. Those two things tend to go hand in hand. And that's backed up by a lot of neurotrauma research as far as when the blood-brain barrier is compromised, how that impacts digestion, and how those things can and should be supported simultaneously because they have that close relationship. So skullcap helps support that blood-brain barrier. It's neuroprotective overall, so it helps protect the nervous system, providing that blood-brain barrier support. It's antioxidant, anti-inflammatory, antibacterial, antimicrobial, antiviral. When it comes to staving off external illnesses, it is a fantastic herb for working with the immune system and any of those sorts of things. It also helps protect the liver, and it can be helpful in glucose support as well. So again, tying this back to some of the, I guess, concerns or some of the conversations around niacin, where glucose levels can be problematic in people who are pre-diabetic or diabetic, need to be really conscientious around their niacin levels. Skullcap helps support healthy glucose levels and maintaining that. So it's often used, at least in my case, working with a lot of neurological conditions as that blood-brain barrier support, but also with anxiety, hypertension, inflammation, arthritis, diabetes support. Respiratory infections, or really in any infections. Skullcap has actually been shown to be anti-MRSA, which is a really treatment-resistant um, issue that can be really problematic in treating with standard antibiotics, allergies, diarrhea, heart and liver support, HIV support, and cancer support because it helps boost the immune system when that immune system has been compromised. Red sage root helps promote cerebral microcirculation. Red sage root is a vasodilator. So it has a strong impact on a number of other things, but here, very strong impact on circulation on the blood. So it promotes cerebral microcirculation. We talked about microcirculation being the far ends of the circulatory system. And so red sage root can be helpful in helping facilitate all of these other substances, including psilocybin, to getting to as much tissue as possible. At the same time, it's neuroprotective. It actively passes the blood-brain barrier very efficiently. It's antioxidant and also anti-apoptotic. So regulating that cell death. So neuroprotective, it's a vasodilator. It's also an adaptogen, helping the body maintain and adapt to stressful environments. It protects the heart, liver, and kidney, and is often used in memory support, stroke, concussion, or traumatic brain injury, depression, anxiety, stress management, issues with circulation, so things like blood clots, atherosclerosis. It's often used in menstrual disorders or menstrual dysregulation, including endometriosis. Um, Cholesterol and diabetes support wound healing and supports the gut as well. So it supports the microbiome of the gut and supporting the gut lining. So it's actually been shown to tighten the gut lining, which again, that relationship between the gut lining and the blood-brain barrier, if one of those is compromised, the other tends to be. So if you can help tighten that gut lining and support that, it's going to have a positive benefit on the blood-brain barrier in supporting that as well. And then lastly, we have tangerine peel. When this is used in herbal medicine, the peel is taken off and it's dried. So it's dried tangerine peel. And this can be given consideration because it increases blood oxygenation levels as it allows for more oxygen to the brain. In Chinese medicine, it's referred to as Chen Pi. It's neuroprotective and increases the cerebral oxygenation levels, helps with digestion. It's an antioxidant, anti-inflammatory, antibacterial, immunostimulant, often used in fatigue, indigestion, bloating, gastrointestinal issues, diarrhea, nausea, and some respiratory stuff, wet cough, when there's tightness in the chest or bronchitis. Can be helpful in blood sugar support, cholesterol support, and weight support. In Chinese medicine, the approach to herbal formulas is that an herbal formula should be balanced. And so you have multiple substances, and rather than saying, okay, this substance does this, and this substance does this, and this substance does this, and we want all of those things, so let's mash them together. The conversation in formulating herbal formulas from Chinese medicine is how are those all going to interact? How does that act as an entire ecosystem of healing? And how do they interact with one another? Are they synergistic? Do, if you Does one have a possible negative effect that we don't want? Well, how can we balance that out? So that we don't have negative effects, so that we don't have side effects. Tangerine peel is one of those that is often used as sort of a harmonizer or a regulator in the larger picture of things, especially when we have so many substances that we've talked about that can be very tonifying for the body, but not necessarily moving. We have some blood movers in there, and this one is the one that really helps with oxygen movement and overall functionality in the body. So it can be a really nice pairing while also being directly demonstrated to help increase blood oxygen levels. So that is what I have. If you are interested in more information, like I said, all of these things that we talked about can be given consideration on their own merits as single substances. And I do have a tincture blend that I have put together that I often use and often pair with our microdosing regimens at the service center. Um, and if you're interested in more information on that, you can go to my website, acuneuromodulation.com. I have a book out called Neuromycology that digs deeper into the medicinal mushrooms, including psilocybin. So if you want any of the citations or you want more information about that research, it's in that book. If you're interested in the blends at all, you can go to sevengatesapothecary.com, or it's distributed by Golden Needle Medical Supply.